Hi, my name is Dr. Kametz from the Gohl Clinic of Chiropractic, and our mission is to help adults and children reach their potential in life by keeping them off of drugs and out of surgery through specific scientific chiropractic care. Today I'm going to go over a case of a gentleman who came in a very acute pain in an antalgic position, and I'm going to show you the results of a specific chiropractic adjustment on the results of his x-rays. This is a relatively normal looking lateral x-ray. You can notice in this you have a lordotic curve in the low back, a kyphotic curve in the middle back, and a lordotic curve in the neck. And you can see this is pretty well aligned. The plumb line driving straight up from the center of L5 goes through C7 and C2. Relatively normal alignment in the spine. Let me show you the presentation that this gentleman came in with. I want to explain exactly how we were able to get the pictures that we needed so we can get this guy some help. In a relatively normal lateral x-ray, the way we take that is with the patient looking straight ahead at the wall, arms about 90 degrees and just letting them go forward and just looking straight ahead. In his position it was a bit more difficult because he came in very, very acute and bent over. So the way he was able to get in position for the picture for us was he had to get onto the wall right here and push himself up to the point that he could grab the stick, and he was looking at an angle when we took the picture. As a matter of fact, on the x-ray you will see his palatine plate is at this high. That's why it gives that neck an artificial looking curve. But it was enough, positioning was okay enough to get a good x-ray on him to determine what was going on. Now, when you have a subluxation, which is the vertebrae shifting backwards, stretching, damaged, herniating the disc, and the inflammation starting to compress that nerve, that will cause pain. But your body's protection mechanism to protect this from getting any worse is using muscle spasm, also called muscle guarding. So the muscles contract very fiercely to try to prevent this condition from getting any worse. And in this gentleman's case, what was happening, it was forcing his spine, especially his low back, into a state of hyperflexion. And what you'll notice on the x-ray is where you would normally have a lordotic low back curve, you will notice it being very straight. I'll post these on the blog so you can actually get a better picture of the x-ray itself. But what I want to do is kind of show you the basics of it here. You can see in his lower back here, you can see this lumbar is almost just straight with absolutely no lordotic curve at all. It's very, very much stacked. In the lower part of the thoracic area, he starts to compensate by shifting forward, and eventually you can see it actually looks like a relatively good looking curve in the neck. However, look at his palatine plate. He clearly has his head shifted upwards, and it's giving him an artificial good looking neck there. Let me show you what happened when we took the post x-ray. The before and after x-ray. What we notice here is after we started correcting that subluxation, you can see now he comes out to a more normal lordotic curve in the lower back, kyphotic curve in the middle back, and he needs to start working on this lordosis in the neck here, but certainly coming out much more normal at this point. Just comparison lines here from a plumb line straight up at L5, you could see his first lumbar is actually 21 millimeters in front of that line. And you can also see the sixth dorsal is actually 37 millimeters in front of that line. And the dens at C2 is 84 millimeters in front of that line. Like I said before, in a more normal looking spine, you would see L5 dissecting C7 and C2. In the post x-ray here, much more normal here, L5, you can see L1 is actually touching that line now. 8 millimeters anterior to that line, due to that bone spur and arthritis there. At T6, you can see that's now 51 millimeters behind that line instead of 37 millimeters in front of that line. And the dens at C2, it is now 32 millimeters behind that line. And also notice here at the neck, where it looks like a good-looking curve over here, remember that's due to the way he took the picture, where his neck was extended when he took that picture. Here now much more level, and you can see the curve straightening. This case you may remember if you saw a video from our brother over in Australia, Dr. Ian Rossborough, he had a condition where a younger kid came in where he was flexed forward too. And that's a very antalgic posture, but once he started correcting the subluxation, he was able to stand up perfectly straight. I hope you find these videos informative. If you're interested in actually seeing these x-rays, you can check the link below. It will take you right to the blog post that has these on. And I'll also be showing the A to P view there also. Secondly, if you're interested in finding more about the office, you can visit gohlclinic.com. You can also find us on Facebook at facebook.com/gohlclinic. And if you want to see more of these videos, you can follow us, you can subscribe to us on our YouTube channel. Thank you.